If you're popping allergy medicine hoping for relief this allergy season, you might not get it. That's because many people don't realize their symptoms are caused by a whole other problem, making it so important to see the right physicians who can help sort it out. Here to talk more is Dr. Roger Friedman with Ohio ENT and Allergy Physicians. Welcome, Dr. Friedman.
Good morning, Crystal. Nice to see you.
It's a pleasure to have you. Now, Dr. Friedman, something that sets your office apart from the others is that you have both allergists and ENT specialists. That's crucial.
That's very important because many diseases, many conditions appear to be allergies, and many people may think they have allergies, but in fact they may have other problems. And that's why having two specialty groups working together as one can make such a difference. People may think that their runny nose and sneezing is due to allergy, and it may be. On the other hand, it may be a sinus infection. They may be having problems with chronic rhinosinusitis, and allergy treatment alone will not be enough for those people to get better. They may need the care of an ENT specialist to help them, and that's what we try to do, is to coordinate care between both of our specialties.
One good example of this, a child maybe suffering chronic ear problems, may have some allergies, but they also may have a deeper issue and need tubes in their ears.
That's right. That about 80% of children who have recurrent ear disease have problems with their eustachian tube. They have eustachian tube dysfunction, and to get them completely better, they may need the insertion of ear tubes by the ENT specialist. But in addition, about 15–20% may have allergies also, and if you just put the tubes in, you may continue to have more problems. So a combined approach with both the allergist and the ENT physician can lead to a much better resolution for the child.
You say it could save the child from multiple surgeries.
Many times children end up having to have a second or third set of tubes, and some of those times it's because the allergies, the underlying problem, isn't being treated, and they just keep having more problems.
Another example, interestingly, you say you get some teens who mistakenly think they have asthma when in reality it's a vocal cord problem.
It's a very common problem this time of year in the fall. In the fall, as sports teams start again, many times young adolescents, more girls than boys, but both can happen, where they suddenly have been elite athletes and suddenly start complaining of shortness of breath. Their family and oftentimes their primary care physician believe that they have a problem in exercise-induced asthma, and they're given inhalers and other asthma medicines. But in fact, many of these people, we can easily find out, have a condition in which their vocal cords are coming together, and it's not really asthma. In many of those kids, with the work of our ENT physician and us, we can make the proper diagnosis and actually be on less medications. And it can make a dramatic difference for our kids.
All right, so what are the symptoms that people should come to Ohio ENT and Allergy for?
So certainly any what we'll call rhinitis symptoms, nose symptoms, runny nose, itchy nose. Initial treatment doesn't work. In other words, if you take simple medicines and they do well, then they don't need to have a specialist. But if they're having chronic ear disease, chronic rhinitis, chronic sinus disease, or in particular asthma, we treat thousands and thousands of children and adults with asthma because most of them have allergies that are exacerbating them, but some of them may have reflux or sinusitis, and again, in collaboration with our ENT physicians, we can make both diagnoses properly.
All right, we have to get to some important news. Breaking news just today. Tell us what you've just heard.
So what's just happened is that, as you know, many children have severe food allergies.
Right.
And one of the things that can be life-saving for them is carrying an epinephrine injector.
An EpiPen.
An EpiPen is one of the names.
Okay.
But there's a second one, and that's called an AVQ. AVQ is, we'll call, a competitor to EpiPen, and thousands of our patients have AVQ devices. Those have just been recalled. The entire country has recalled all of the AVQ epinephrine injectors. And so patients out there who are carrying an EpiPen are okay, but if you're carrying the AVQ, you need to call your physician, you need to call your healthcare provider, because you need to now get an EpiPen and to turn back your AVQ, because they've been found to sometimes give inadequate or improper dosing.
This is so crucial because this is life or death for someone having an allergic reaction.
It can be. Now, fortunately, there have been no deaths reported, and the company is doing this voluntarily, but they have been having inaccurate dosing from the AVQ, and so you need to call your doctor, you need to get an EpiPen, and you'll be able to return the AVQ to the manufacturer.
Dr. Friedman, thank you so much. For more information, you can contact Ohio ENT and Allergy Physicians. Thank you, sir.
Thank you.